So I saw a very unfortunate news story recently where a CNA was charged with the death of a patient that fell from a hydrolift that she was operating. I'm gonna give you a brief synopsis of what happened, then I'll tell you what I think about the whole situation. Hey you guys, make sure you subscribe to my YouTube channel, Kate the PA. So, a CNA was working at a nursing home in June 2024, and she was operating something called a Hoyer lift, which is a lift that is used to transfer patients from the bed to the chair and vice versa. And she was operating this machine by herself, where normally you would need two people. Then the patient ended up falling and succumbed to his injuries from that blunt force trauma. So unfortunately, the patient ended up dying, and now the CNA is being indicted for homicide. So this situation is just terrible all around. I feel so bad for the patient, the family members, and even the CNA. I could tell you that 9 times out of 10, the CNA was probably working short staff, especially in a nursing home, and she may not have had that second person to help her with operating that lift. I think that happens more times than people can ever imagine. And that's why I'm not going to be so hard on her. Of course, she did not make the best decision by operating the lift by herself. I mean, that definitely is negligence if you know, look up the definition of negligence. But I can tell you that so many people have their back up against the wall in healthcare. You're working short staffed, you're working by yourself, and you feel like, okay, if I don't do this, then nobody will. Many times you may not have that second person to help you out, and that's when you really have to be careful, because it's so tempting to do what she did and operate this equipment by yourself. And many times you're left to suffer the consequences by yourself when you decide to play superhero. That's why you cannot go into any job and do extra. You know, you have to just do what you're there to do. Whatever's in your scope of practice, you know, you got to follow the rules, because many times you are working for this company, you are doing a great job, you are overworking, you are doing stuff by yourself when you shouldn't be doing stuff by yourself, and it ends up that you are going to be the one that suffers the consequences, which is very, very unfortunate. That's why you just got to go to work. I would say do the best you can do, don't play superhero, and go home. It was also mentioned that this nursing home had a 1-star rating, and they also were known to abuse patients. So I don't know. I feel so bad for her. And, you know, this is something that can happen to anybody in medicine, not just in this situation, but in so many other situations, because I don't think people realize how hard it is in healthcare. You're trying to be there for your patients, and sometimes, you know, you put your cape on and you try to go the extra mile. You do stuff that you probably are not supposed to do in the sake of trying to help the patient. But that's why I really hope that the nursing home steps in and at least help her cover the cost to get a really good lawyer. But I highly doubt it. The family does deserve justice, but I think that the nursing home should also be investigated, because this shouldn't just be all on her. Of course, you know, she didn't make the best decision by operating the equipment alone, but that nursing home needs to be investigated. But yeah, that's my take on it. I want to hear what you guys think about this situation. It's so unfortunate for everybody involved, and condolences to the patient's family. Comment below what you think, and I'll see you guys on the next one.